Shed a lot of fibrous tissue here from the previous surgery. This is dangerous. I mean, this is the most fibrosed I've ever seen one. It's called a subarachnoid diverticulum. Normally this would be pretty simple. We just slap a plate down on 2 vertebrae on either side, done. But this is like way more challenging. Have to be super careful here. Daisy, FYI, I'm on the top of the ribs on the pleura. This is the dangerous bit. Just keep an eye on the respirate for me. And the thing is, the dog is going to get worse as a result of this intervention. Yeah. I'm hoping it'll be a temporary setback. Question is, can we stop him ultimately being paralyzed? It's extremely hard. It's unprecedented.
So this is the biggest one you've done?
It's the biggest one anyone's done.
Hi, so my name is Ronan Duffy. I'm here with my boyfriend Paul and our pet Milo. So Milo has a reoccurring cyst on his spine, and unfortunately he had it sort of 4 years ago. Noel's team, they removed it. It went really well. Got sort of a warning at that point that it could be a year, 3 years, but the likelihood would be that it would come back, and unfortunately it's come back. So Milo's a classic lockdown puppy. We got him in 2020. I think we were aware of some of the issues they could have, but not as many as he's had. The first thing we ever noticed was cherry eye popped out, so his tear duct popped up, and then a very similar thing, he started walking around like a little drunk man, which was a bit of a scare for us, and that's when we first brought him in here and got the cyst identified, had that removed. I think in the second year he had boa surgery, so proper airways, trying to make his breathing better. Possibly hear him snorting in the background still.
We're aware there are issues, so we did actually invest and we did actually get very good insurance.
Oh yeah.
Which has actually paid for itself multiple times over. So, and we got a lifetime policy to cover things that may reoccur again, in which case he's quite covered for what's happening right now. That's if someone is considering getting a Frenchie. I mean, insurance and quality insurance is definitely recommended.
I think today is one big giant worry. When he's good, you wouldn't know anything's wrong with him, and that's part of the apprehension with going in for today.
The issue is that it's progressive, and it did, like over Christmas, it was bad for like a couple of weeks. And so it is something that will get worse and worse. Right now, you wouldn't even know there's anything wrong with him. But yesterday, like, they were shooting out again, which is sad, but it kind of gives you comfort. Okay, there is an issue here. It does need to be addressed, because if we don't do anything, it will just get worse.
We did have quite a few discussions about that sort of, should we wait, should we see how it's going on? Like we know that after this there's going to be physiotherapy needed, there's going to be all that kind of treatment to get him back, learning to walk again, learning to do all this stuff again, and it's trying to get him back to as good as he is now. Like, he's never going to be better than he is now, whereas if we wait longer and he deteriorates more, you run the risk of not getting back to that stage. Like, if you wait until he can't walk anymore, he's lost all function in his back legs, it might be too late.
Right, Milo's family.
Oh, yeah, here we go.
Morning, Milo.
Yeah.
Morning, lads. How are you doing? You've been to Dublin Airport. I've been around the loop. I've been around the loop a million times. I've been around that loop so many times. Now, mister. Yes. And how about the ataxia? Has that stayed more or less the same? Is there episodes where it's worse than it is today?
Yeah, so yesterday I was giving him a bath and his leg went flying out.
Okay, just to draw your attention back to the images. This is the area where the spinal cord is getting worse due to this fluid accumulation, and that's a subarachnoid diverticulum. We're going to endeavour to do two things. One, open up that fluid sac again.
Mm-hmm. Yeah.
Two, we're going to endeavour to stabilise the entire area of spine that is linked to the abnormal motion which is contributing to the subarachnoid diverticulum. In other words, the cystic fluid thing is filling up because of adhesions between the lining of the cord and the cord itself, and those adhesions are made worse by the movement, the abnormal motion. So we're going to stabilise it so there's no abnormal motion, but we're also going to release the fluid again. Three things to say about that. Number one, he may get worse when I release the fluid. 2, we can't be sure it won't come back. 3, the operation's a big one and it's a long one. It's a humongous piece of engineering. It's the longest one that I've ever put in. So basically, if I stabilize the area that is currently the problem, which is what I would normally do, I would only go 2 vertebrae each side. Then it will be 1/3 of the length of that. If I do that, I'll stress concentrate into here and you'll get a problem here.
Yeah.
The problem I've got with this surgery is that is like Niagara Falls. It doesn't look too bad on a CT scan, but as a surgeon, when you cut through here, that looks like it's down the bottom of a deep, dark well.
Yeah.
Humongously deep.
Got you.
Hugely challenging. So the big challenge for me all along, which I've now said to you 3 times, is do we really need to do this? Is he going to get worse anyway? Why are we doing it? And why we're doing it is to try and stop him getting worse.
Yeah. We've had the conversations before.
Yeah.
We've thought about it quite a bit. I think it's more the fact that this is progressive.
Yes.
And it will get worse, and we will eventually come to a sticking point anyway.
Yes.
So if we can preempt it.
Come up here. Whoa! Yeah. There you go. Now you're set. I know. Yeah. Give him a kiss. Okay. He's just filled my nose with saliva. And you know how I love tongues up the nose.
Yeah.
All right. Good. All right. You're welcome.
Cheers. Thank you, Noel.
I'll ring you tonight. It's unusual for me to be doing such a significant surgical intervention, which is partly to treat what we've got now, but mainly to prevent what's inevitably going to happen as the condition gets worse, which is a lot better than we're doing with climate change, because the next generation are going to pay a price for our selfishness and our reluctance to take action in the face of an inevitable disaster. When a disaster happens, we all react, but very few people are proactive. Very few people see the danger and act to prevent the danger happening. And it's true in all walks of life. Jack the table up, please. Up, 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 up. Keep going, keep going, keep going. Up, 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 up. Stop. This is the implant. It's a work of art. Look at that. Dun, 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 dun. All right, we're going to rock and roll here. Give me a stapler, please, somebody. You have to be careful over the ribs. You could perforate the pleura. Very, very tricky up in the thoracic region because you're going down Niagara Falls. There's a lot of scar tissue here making my life really challenging. This is made 10 times more difficult by the scar tissue from the previous surgical intervention. We've now lifted the bone off the roof of the spinal canal. That's the spinal cord right there. That is the cable of life. And this is scar tissue stuck to it. I can't tug at that because if I do, I'll damage the cord. So I have to very gently move the bone away from the cord as best I can. And I got to get off all this scar tissue as much as possible to get down and cut into the lining of the spinal cord in order to release the fluid. I'm relatively fortunate in that I'm extremely short-sighted, which means this distance is perfect. I can see everything and I don't need operating loops, but I have no idea what's happening outside of the surgical area, which it makes me very focused on the surgical site. Ladies, I am going to cut into the spinal cord. Are you on the anesthetic? Yeah. Right, be all over it, please. Yeah. I'm going to cut now. Quiet, everybody. So I've just cut a hole and you can see fluid leaking out of that hole. That's the cyst, and this is the fluid coming out of the cyst. I'm going to enlarge that hole now. I have to strike a balance between doing too little and too much. If I do too little, I won't relieve the problem. If I do too much, I may cause a problem. All right, so what I'm going to do next to try and stop this scar tissue sticking down again, I'm going to use this suture material to marsupialize the sac, meaning open it like a kangaroo pouch. Now, Mitch knows all about that because he's from Australia. Okay, that's that bit done. All of you tonight are doing the world's first long FUSS plate, F-U-S-S, which stands for Fitz Universal Spinal Fusion. The advertising slogan on the television is, "What's all the fuss about?" Tough crowd. We do not want the fibrous tissue sticking back down, so there's a roof over it. So when this is stitched back over, fibrous tissue can't stick back down to the cord. These hooks prevent the plate drifting, and they mean that these screws should be in the right position. So now the next scary bit, which is to put screws into the holes. Give me 2.0 regular screws, please, because I'm about to drill. Here we go. Keep on that anesthetic. I'm in a very dangerous spot. Anesthetic okay? Right, the most dangerous screw is going in now. Stay all over that anesthetic. Alrighty, I'm putting in the last screw now. I should be feeling some relief at this point, but I'm not, because I can't be sure until we do the CT scan that all the screws are in the right spot and none of them are touching the spinal cord. And that's always the most difficult moment for a surgeon like me, who not only is a perfectionist but has to be a perfectionist, because this has to be perfect. You cannot be 1 millimeter wrong. That's us done. We're out of here. Nice new lid on the spinal cord. All the vertebrae stable relative to each other. All right, mister, you under there? There you are, good boy. Well done, mate. What we do know is we've done the right thing. What we don't know is what's going to happen next. And that's the difficulty with elective surgery. If you don't do it, bad things are going to happen. If you do it, bad things might happen. So, first things first, I took CT. Those are fine. That's excellent, really good. Cord is there, screws are there. That's fine. They're all fine except the front two. It's disappointing, but what can you do? And they're too near the spinal cord, so I'm going to have to go back in and take them out. It must be a situation where the plate has tilted slightly. It's very difficult to understand how that would happen. Vertebrae are so deformed. See that vertebra there? It's in several pieces. So that screw went to the wrong angle because the vertebra itself twisted relative to the plate. Anyway, gotta go take it out. Unfortunately, the vertebrae are malformed and they twisted slightly, just a few degrees, relative to the plate, maybe only 3 or 4 degrees, as I placed the plate and pushed it down. The cord will be fine because they will just have pushed the cord over. And because the rest of the plate is rock solid and the screws are perfect, so I probably don't need these 2 screws anyway. I don't think he'll be standing tomorrow. I think we have to hope that he stands within a week and walks within 2 weeks. I have no doubt whatsoever that he was going to get worse. I know for sure that we did the right thing. All right, Milo. Hello, buddy.
Hi, mate. You're up. Who's a good boy? Milo's a good boy. Oh, Milo's a good boy.
All right, Milo. Take it easy, buddy. Thank you. Oh, that's good, Milo. That's good. You've got tone in both back legs, matey. That's very good. That's very encouraging that he has enough tone in both back legs to stand with just one finger support here on the other side. We got to bear in mind that he is still under the influence of a cocktail of Class A drugs. So we don't expect him to be doing anything different than this. We need him to rest today. I'm just going to check his feet now. Good boy. Oh yeah, that's a good boy. That's fine. Well done. Just think. Oh yeah, that's good. That's what we want to see. We want to see you can feel your footsies. He definitely has a long way to go. I expected him to get worse before he gets better. My main worry today was that in opening up the spinal cord structure, that the spinal cord would be woefully set back. That I was deeply concerned about that balance between doing enough to get rid of the fluid, but not doing so much that I damage the cord. It looks like I got the balance right. And that's a wonderful thing, because the first tenet of all surgery is first, do no harm. Well, it's an immense relief, but also it's a blessing. You're a good boy.
Milo's a Frenchie who's had quite a substantial and complex surgical procedure. As the vet nurse, it's not just the surgery that is incredibly important, but also the post-op care. Luckily, he's insured, which helps with the cost of the surgery, but also the substantial amount of post-op care in his convalescent period. After a complex spinal surgery, the patient will need analgesia. It's going to need things like physiotherapy and bladder management, and there will be many nurses and veterinary care assistants and vets as well taking care of them for many days post-surgery, and insurance obviously helps with that.
Let him rest. We'll start physio tomorrow. That's good. Well done, mate. Good boy. Milo's going home, which is fabulous. He's getting stronger all the time. Hey, mate. How you doing? Guess who's here? Guess who's here? Oh, look at him go. Who's a good boy? Who's a good boy? Oh, look at you getting up and about. Well done. Well done. Oh, Milo. Oh yeah. Oh yeah. Oh yeah. Oh yeah. Oh yeah. Oh yeah. That's it. Thank you. Well done, Milo. Good boy. That's it. Right. Let's have a look. Let's pop him down on this end of the mat. Come on, bud. That's it. Let him take more weight. That's it. Good boy. Good boy. Well done, buddy. Stop. Okay, so as you can see, his left hind is recovered quicker than his right hind, which is remarkably surprising given that the surgery was done on the left side, which means that the opening of the cyst is the problem. So the structure in his spinal cord stuck to all that fibrous scar tissue is the problem, and that's why he's weaker than he was before surgery, which is what we would expect, and the family know that. But they also know that he would have ended up in this situation anyway because of the disease he had. Now we have a chance to get him hopefully better than this, whereas if he had gone to this naturally, we most likely would never have got him back. Good evening, gentlemen. Come on in. So he's fine. The biggest challenge he has is me cutting open that fibrous scar tissue within the cord. The plate is not the problem at all. The problem is the scar in here. These two screws would not go in the right spot, so I left those empty, but it's fine because I've got hooks behind all the vertebrae anyway. All that is rock solid. I'm not concerned about any of that. But he is worse on his right leg than on his left leg, even though we've put the plate on the left side, which tells me for sure that his problem has nothing to do with the plate. The plate's fine. His problem has everything to do with what's going to happen now that I've cut the cyst open. Can I bring that in here? Yeah, gentlemen, I can bring you in here because we've got two mats in here. There you go. Oh, good boy. Oh, good
Now, there he is.
It's like,
There he is. There he is. Oh, yeah. Good boy. Good boy.
So I'll show you the exercises in the conjurum, but I just want to show you how he's walking, because we put down these mats to just show you how he's walking. He's able to move the left leg pretty good, not so much the right one.
Okay.
You see that?
Yeah.
Okay, now Mitch, pick him up. I'm going to go back in the conjurum now. So what we're going to do is we're going to work on him with exercises. He's peeing with excitement. He's actually peeing fine.
Okay.
So, but you've seen how he walks now. Up and down in there, Mitch, and and take out your phone because I want you to video what I'm doing. So basically, in the morning, at night time, and once during the day, you're going to do these exercises. So if you'd be so kind as to film, you ready?
Yeah.
Exercise number 1 is simply balancing. You're just going to rock him from side to side to encourage feedback of the nerves. Then, because the right hind is worse than the left hind, we're going to do a minute on the right hind alone. See that?
Yeah.
Okay. Third one's super easy, it's the bicycle. We're going to flex the leg completely. We're going to pull forward high so that the foot touches the elbow. Then we're going to rub along the ground, which is the vital bit. Then we'll flex the knee so the hock goes up to the hip.
Okay.
Super clear?
Yeah, makes sense.
Good. And he's actually getting strength back all the time, so I do expect that he will recover. But you got to keep the exercises up.
Cheers, Noel. Thank you so much.
You're welcome.
Cheers, Noel. Bless you. Take care.
he's getting there. The toughest thing for us is probably that he's still incontinent. In his case, there's like a window of time that we just have to make sure that he's outside and he can do his business and then get on with the day.
But it's more about just keeping up with the exercises. He's still quick. He wants to run around the house. He still wants to play a lot. He's a happy dog, which is good, and he's moving. So
He's really happy. He loves to play with us still. It's all healing as expected, and ideally that if we carry on with doing all the exercises that he'll keep improving. Notice? You ready?
Come on! Oh, good boy.